guys, what is up? Welcome back to Simplified by Gina Shah. It's Diwali over here, but we are going to do a drug which is called as Physostigma, and I just write it in this way so that it's easy for you to remember. We are going to talk about Physostigma. My favorite way of remembering a drug is by its name, and the way I've written it, astigma. It's not a mental symptom, it's actually a physical symptom which talks about astigmatism, right? So, especially for everybody who's in the third year who has ophthal as their subject and has astigmatism, studied astigmatism, this drug has a lot of eye symptoms. Okay, and we are going to go deeper into what these eye symptoms are. Astigmatism is a clear clue that there are eye symptoms, correct? I like to draw because that helps me retain things better. This is eyeball for whatever reason, inaccurate. Um, Now, what does this person has in eye symptom, right? One is blurry vision, which includes everything that is dim, fuzzy, distorted. If there is like a signal light, it would appear more of like this. So it's more distorted vision with flashes of light. Now, the key idea or applying materia medica is to understand which clinical conditions have it, and almost all clinical conditions when it comes to eyes would have these conditions. It is maybe related to lens, maybe related to cornea as well. Any infection that causes a lot of watering in the eyes could also cause blurry vision because of the water. Irrespective of the cause, if these are the symptoms, then physostigma is an indication. Like I mentioned, there is watery eye, maybe because of infection or anything that's irritating in the eye. So there is a symptom of profuse lacrimation. Most common in today's day and age is because of laptops or eye strain because of screens. That is also covered in this remedy, eye strain. And most common symptom of eye strain is headache. Headache is primary more often, and then even eye symptoms are very common in today's day and age when all our work is on laptops and screen. And headache is again pain around the orbits. Too much screen time, too much gaming, too much working on the laptops, right? There are some symptoms that are mentioned in materia, which is contraction of pupil. Now, only way I can explain or understand this is when you're watching TV or when you're watching screen with too little background light. If it's more seen with lights off at night, that's when your pupil would be contracted because it has to focus. Then there is a symptom of floating objects, which is black floating objects. Now, this is common with diabetic retinopathy, where you see such floating objects. Then there is a symptom of twitching of muscles or eyelids. So basically, if you see, all these conditions may not be tied together with one clinical condition. Maybe there is a chalazion that is causing twitching of eyelids with blurry vision and lacrimation. That's possible. Maybe there is an eye strain that is causing headache with lacrimation because there's screen time, or there's something probably different like black floating object because of diabetic retinopathy, which may not have lacrimation but it will still have blurry vision. So you pick and parcel and choose it. Most common pathology that are mentioned in books include myopia, nystagmus, glaucoma, and night blindness. Right? This is about the eye symptoms. One more thing we can add with twitching eyelids is post diphtheric paralysis, which we just did in a drug, diphtherinum, where they also had post diphtheric paralysis, but it was more in the throat symptoms. Um, Now we go to another side of the drug, which is the physo part. Now I would like to read it as fight. And this talks about a very intrinsic system which gives rise to fight flight response. Now, why will I call it fight or flight response? Because of the symptoms that are mentioned. One symptom is increased heart activity. We all have studied autonomic nervous system, right? There is stress, there is feeling of anxiety. So here it talks about fluttering felt in throat, pulsation felt throughout the body, increase in blood pressure. So, if you just talk about, or how I see it, is physostigma or the fight response here is not just acute, but it could also be chronic. In terms of if somebody is constantly in the fight zone, constantly anxious, constantly feeling in the survival mode, there is increased heart activity, there is fluttering, there is some sort of anxiety and anxiousness, increased pulsation, which also includes increased BP, right? The person can feel the beats of the heart distinctly perceptible in head and chest. This could be acute, it could be panic attack, and it also could be a chronic symptom. Okay, as opposed to fight and flight, right, which we are talking here. In fight and flight, what we have is dilation of pupils because you're supposed to see through if there is any danger. But here, this remedy has contraction of pupils. So, that's a good way to remember and link physo and astigma. In fight or flight, you usually have dilation of pupils, but this remedy has contraction of pupil. Now, these are just ways and words how we've learned it. Okay, this remedy is not indicated in this or that, it's indicated in totality. Then, but in physostigma, you have contraction of pupil. Other few symptoms that are there in physostigma but are not related to fight or flight response include depressed motor activity. Then there is increased peristalsis. There is depressed motor activity could be linked to some neuralgia or paralysis condition. Increased peristalsis leading to diarrhea. There is muscle rigidity, there is contractional problem and paralysis. Just an additional symptom is pain in right popliteal fossa, which is just unrelated symptom to whatever we've discussed so far. Um, some other causes, not just astigmatism, not just post diphtheric paralysis, some other pathologies that are included in this drug are tetanus, spinal irritation, or any spinal injury, polio, then meningeal irritation or meningeal injury. Now, these symptoms mainly contribute to depressed motor activity or rigidity or paralysis. Along with that, you would also have some burning, that is neuralgic symptoms, and tingling. Hands and feet are numb, there is sudden jerking, there is tremor, there is chorea. So, all these would be because of these symptoms. So, in totality, if I had to remember this drug, one easy step is astigma, which gives me a clue for eye symptoms. And then I put down some basic common symptoms of eye diseases that I know of. Second is fight or flight response. I'm sorry for the cracker noise. Fight and flight response, I know some basic common ANS symptoms, and I know some versus symptoms that are usually seen in a fight or flight response, but the remedy doesn't show it. And third thing which I know is something that relates to paralysis or depressed motor activity, which has a few causations. And that's all. That is Physostigma for you. In case if you've missed any symptoms or any signs, please comment down below, like, share, and subscribe the channel, and send it to your friends as well. Thank you, and see you soon.